Hey guys, Dr. Taylor Premer here with Winchester Spinal Support. Thank you to Dr. Tyler White behind the camera helping me out. He's doing some filming. So today, I hope you guys got to check out our video with Nancy Slater yesterday. It was an amazing story. She kind of explained her process of kind of taking back her life. We were lucky enough to have a little bit of an impact on that. Dr. Winchester, Dr. Fulano, Sheila, we all kind of had just a little piece of that, but a lot of it was just her kind of taking control of her symptoms, and now she's living her best life, basically. So to keep going with our Spinal Stenosis week, the initial automatic assessment that we do with any patient that comes in with low back pain, since we're talking about low back pain stenosis, but any really joint pain in general, is going to be a directional preference exam. Why that's important is because we can make long-lasting and quick changes to pain and range of motion by just repetitively doing a range of motion. Usually with stenosis, it's going to be flexion, so that means bending here at the lumbar spine. Now the reason that is most common is because as we flex our spine, right, coming through here, if we zoom in on this right here, right? As we flex, we open up the IVF here. So we allow just a little bit more room for that nerve root. Now that can help us take some pressure off that. That can alleviate symptoms that are maybe radiating down the spine. And it can basically just buy us a little bit of time so that we can kind of help decrease the symptoms before we start to rehab and bring in other things like that. Just because the majority of patients don't... Did you just turn around?
Yep.
A good little close-up.
That was haunting.
So just because, however, the majority of patients respond to flexion, that's going to be the first thing that we go to. Now, we may be completely wrong in stenosis patients sometimes respond to extension. Now, the biomechanics of that don't necessarily 100% make sense, but we're always going to go off symptom response, and we're always going to pick the direction that's going to make the biggest improvement. Okay, what that means is that it might be something that we do long term if there's bony changes, if there's actually changes within the IVF or within the canal that are making those symptoms. But however, our goal is to basically figure out why that was caused in the first place, whether that's functional deficits, whether that is the other things that we're going to review later on this week, thoracic extension, hip extension, intra-abdominal pressure. Our goal is to basically get you away from the directional preference after we've reduced it, and then get you back into a rehab program. And then eventually, which we're going to experience on Thursday, we'll go live with Sheila in the gym with our special populations class, which is then getting you into a functional movement where you're deadlifting, where you're doing dead bugs, where you're doing ladder drills, all these other things that are kind of, now it's in your hands. So it's less of us in this treatment room and more of you living your life. So hope that you like that little explanation of directional preference and why it's our baseline assessment. And we'd love to see you in the office if possible. So our number is 636-356-5557. Thanks for tuning in, guys.
Sorry about the scare.